In this section, we will discuss the different ways public services activities can meet the different national objectives and how to document that you've met one. There are 3 CDBG national objectives: benefit to low and moderate income persons, prevention and elimination of slums and blight, and urgent need. In many cases, public services activities meet the national objective criteria of benefit to low and moderate income persons by satisfying either the area benefit or limited clientele subcategories. There are 2 other subcategories: jobs and housing, but these rarely apply to public services. The area benefit subcategory requires that at least 51% of the residents in a service area have low to moderate incomes, and that the services are targeted to individuals living in the qualifying area. Some examples of CDBG-funded activities that are eligible under area benefit include crime prevention activities and community health services. If using the area benefit national objective, you will need to identify boundaries of the service area, demonstrate that at least 51% of people living in the area have low or moderate incomes by using the CDBG Low and Moderate Income Data Map application, or by conducting an income survey. Demonstrate that the area is primarily residential through a zoning map. HUD provides several resources and guidance materials on conducting a valid income survey. The CDBG Low and Moderate Income Data Map application can help define service areas. The other way to meet the national objective criteria of benefit to low and moderate income persons is through the limited clientele or presumed benefit subcategory. In these cases, the activities assist people who have demonstrated that they meet the low or moderate income threshold, or are presumed by HUD to have low or moderate incomes. Under limited clientele, services are targeted to low and moderate income persons or people who are presumed to be low or moderate income, regardless of where they live. Let's talk about qualifying activities and beneficiaries under limited clientele. Some examples of CDBG-funded public services that could qualify under limited clientele include after-school programs for youth and job training programs. When qualifying beneficiaries of these programs, grantees must document the income of the persons assisted by the service and demonstrate that at least 51% of the clientele are persons whose household income does not exceed the LMI income limit. Each person assisted must go through an income qualification process and provide documentation, such as pay stubs, bank statements, and income tax returns, to certify that their income meets the low or moderate income threshold. Grantees can use the CPD Income Eligibility Calculator on the HUD Exchange to help qualify applicants. To establish income qualification, grantees may also accept income certifications or document that a beneficiary is eligible by verifying that they previously qualified under another program, at least as restrictive as the LMI income limit. Like all activities, grantees must maintain accurate and complete records for each person receiving direct assistance. As already mentioned, HUD presumes certain groups of people have low and moderate incomes. They are persons who are elderly, severely disabled, victims of domestic abuse, abused children, illiterate adults, people who are homeless, migrant farm workers, and persons living with AIDS. Some examples of CDBG-funded public services under presumed benefit include health services at an AIDS clinic and mental health counseling for people experiencing homelessness. A common question is, at what age is someone considered elderly? With regard to public services activities, HUD does not define the term elderly, and therefore allows grantees to use local prevailing definitions in meeting a national objective. The selected definition needs to be used consistently. Note that for CDBG housing activities, the definition for elderly differs. Presumed benefit also applies if the service is of a nature and offered in a location such that one may conclude that the beneficiaries are low and moderate income. For example, childcare services in a women's domestic violence shelter. When meeting this subcategory, grantees must demonstrate that their program design targets populations presumed to be low and moderate income, and establish policies and procedures to ensure that the program strictly serves that population. Grantees do not need to collect and document income information. Rather, they need to document that the person fits into one of the presumed benefit categories. While most public service activities meet the national objective of benefit to low and moderate income people using either area benefit or limited clientele, some activities can meet other national objectives, including elimination of slums and blight and urgent need. Examples of these types of services include provision of crime prevention counseling to residents of a designated slum blight area, provision of additional police protection to prevent looting in an area damaged by a tornado. Let's look at an example to illustrate how grantees can design public services programs to meet a CDBG national objective and meet a CDBG eligible activity. Jonesville is a U.S. city with a growing senior population. The number of elderly residents in Jonesville, USA increased 15% since the last U.S. Census. Mrs. Roberts, the Senior Center Director, has been getting an increasing number of requests from seniors and their families for services to help them continue to live independently in their homes. These services include food delivery, ride services, home health care, and financial counseling services. Mrs. Roberts, overwhelmed by the demand, calls Mr. Frederick, Jonesville's Community Development Director, for help. Mr. Frederick is happy to help. He knows that whatever service they design, they would serve seniors, a presumed low to moderate income population, and will meet the national objective of benefiting low and moderate income people. They just need to make sure the activity is CDBG eligible, and that it is a new or expanded service that has not been funded with CDBG or municipal funds in the last 12 months. Also, they will need to ensure that funding the new activity will not displace previously allocated municipal funds. Mr. Frederick reviews the available community services and verified that food delivery, home health care, and financial counseling would all be new services in their community. Ride services were previously available, but only offered on an ad hoc basis to limited locations. He and Mrs. Roberts plan to expand ride services to a regular, more frequent schedule and to a greater number of destinations, so this is also an eligible service. Thanks for watching. Click the video thumbnails below to learn more about how to use CDBG for public service activities.